Okay, so you know how it is. You want to get to the good stuff right away. You want those nuggets of knowledge. You don't want to wade through a ton of stuff to get to the interesting parts.
Exactly.
That's what we're all about right here. And today we are diving deep into the story of Hims and Hers Health.
Yeah, a company that has really changed the game when it comes to healthcare.
It really has.
Yeah.
And we've got some really fascinating sources for this deep dive.
Yeah, we've got a collection of news articles and reports that track their journey all the way from when they started as a startup back in 2017 up to right now, 2025.
So that's a good chunk of time. And for you, our listener, the goal here is pretty simple.
Yeah.
We're going to unpack this whole story, the big moments, the innovations, the challenges that they faced.
Right.
And by doing that, we're going to try to understand what the Hims and Hers story can tell us about how healthcare is changing and evolving.
Yeah, exactly.
So we'll be looking at how they dealt with sensitive topics, the role of technology, and how they adapted to some really big changes in the healthcare landscape. So let's go back to the beginning, 2017. What sparked this whole thing?
Well, it all started with Andrew Dudum, the founder. He was noticing something interesting.
Okay.
He saw that a lot of men around him were struggling with things like hair loss or sexual health issues.
Yeah.
But there was this big hesitation to actually seek help,
Right.
this sort of embarrassment that stopped them from going to the doctor.
Is that classic thing, isn't it? Guys don't really talk about these things,
Exactly.
let alone walk into a doctor's office to discuss them.
Yeah, exactly.
So who joined Dudum to get this whole thing going?
Well, he brought on two co-founders, Jack Abraham and Hillary Coles. And their initial idea was pretty simple: make it easier and less awkward for men to get the treatments they needed for these often sensitive issues.
Okay, so straight to the point. And then Hims officially launched in November of 2017. And this wasn't your typical walk-in pharmacy, was it?
Not at all. Hims started out as a direct-to-consumer wellness brand operating entirely online through telehealth. So, customers would fill out online medical questionnaires, and then licensed physicians would review those, and if everything looked okay, they could get prescription treatments delivered right to their door.
That's pretty revolutionary for the time. How was that even legally possible back then?
Well, it was all thanks to the changing laws around telemedicine regulations. We're starting to loosen up, allowing prescribing via online consultations in more and more states, and Hims was right there, ready to capitalize on that.
Wow, perfect timing.
Yeah.
So what were the very first things they offered? What could you get from Hims right at the beginning?
Well, one of their first big products was the $44 complete hair kit, which was a pretty good deal. It included finasteride, which is the generic for Propecia minoxidil, drops of DHT blocking shampoo, and even biotin vitamins.
Wow, so it was a whole package.
Yeah, it really was. And interestingly, they also started offering sildenafil quietly, which is the generic version of Viagra. They knew the patents had expired, so it was a lot more affordable.
Okay, so right away they're addressing two big areas, hair loss and ED. But I also remember that the way they presented these products was very different.
Oh, absolutely.
Yeah.
Yeah, the packaging was really sleek, minimalist, pastel-colored bottles and kits. They looked more like something you'd find in a fancy skincare shop than a regular pharmacy.
Yeah.
It was a very deliberate choice to get away from that clinical, sometimes scary look of men's health products.
It was a whole different vibe. And their branding was also super intentional, that the clean design.
Right.
It was the opposite of those hyper-masculine ads you'd normally see for these types of products.
Yeah, totally. They went for a softer look, clean lines, a bit of botanical imagery, and their tone was very frank, even a little humorous.
Yeah.
It was a huge contrast to that kind of aggressive, in-your-face marketing that had been the norm for men's health for so long.
I remember all those early comparisons. Glossier for dudes, Goop for men.
Exact. Yeah.
It really captured how different this whole thing was.
Yeah, it really did. And some people even wondered at first if it was a parody,
Yeah.
But the customers started coming in droves, so they knew they were onto something.
I bet they did. And it wasn't just a trickle, right? They had some seriously fast growth right out of the gate.
Yeah, they did. Reportedly, they made over $1 million in sales in their first week.
Seriously, in 1 week.
Yeah, their small team of 10 people was scrambling to keep up with everything.
They must have been overwhelmed.
Oh, yeah, Melissa Baird, their COO. She even said everything broke, which just shows you how massive the demand was right from the start.
Wow. So clearly they'd hit on something big, an unmet need.
Yeah.
What was the philosophy driving this early success?
Well, at its core, it was personalized care delivered conveniently. Dudum had this vision of Hims as a long-term wellness brand, something that would grow with its customers.
I see.
It wasn't just about writing a quick prescription and then never seeing the customer again. And the thing about their initial offerings was brilliant. Not just addressing common issues, but choosing ones where stigma was a huge barrier.
Yeah.
Like hair loss and ED are really common, but people often feel embarrassed to go to a doctor for those things. So an online solution was perfect.
Right. It was discreet, convenient.
Exactly.
So they were thinking about building a relationship with the customer right from the start. And the name Hims wasn't the whole picture either, was it?
That's right. They actually named the company Hims and Hers right from the beginning, which was a pretty clear sign that they plan to go beyond just men's products and address a much wider range of health needs.
Yeah, I noticed that. And they also made a point of educating people,
Right.
right?
Absolutely.
It wasn't just about selling products.
Right. Their website had all this educational content and statistics, things like hair loss affects 50 million men in the U.S., or 40% of men by age 40 experience ED. They were trying to normalize these conversations, reassure people that they weren't alone in these struggles.
And especially in the online world where there are so many questionable health claims that focus on science-backed products, that must have been really important.
Oh, it was huge. They were positioning themselves as a trustworthy source committed to high-quality services delivered by licensed medical professionals and offering products that were backed by real scientific evidence.
So after that strong start with Hims, they quickly moved on to the and Hers part of the equation, what happened in 2018.
Well, building on their success, they launched Hers in October of 2018. Hillary Coles, one of the co-founders, described Hers as Hims' more refined, older, badass sister.
I love that. So basically the same strategy, but for women's health issues.
That's it. They kept that winning formula, the stylish branding, the telehealth access, the open and honest communication, but now it was focused on women.
Okay. And what were the main areas Hers concentrated on at the beginning?
They started with birth control skincare and women's hair care. They offered online consultations for contraceptives and shipped FDA-approved birth control pills directly to customers. They also started tackling acne and other skin concerns with prescription topicals like tretinoin, as well as over-the-counter skincare products. And similar to the men's side, they had solutions for female hair loss, like minoxidil foam and biotin supplements, all with that same appealing branding. And they even offered emergency contraception through the platform.
So they were really building out that platform quickly. And Dudum had mentioned wanting to expand even further right from those early days.
He did. Even early on, he talked about things like vitamins, sleep aids, dermatology services. The launch of Hers was all part of this bigger plan to create a truly comprehensive health platform for everyone, addressing those issues that often carry a stigma.
Yeah, and it wasn't just about addressing a need. It was about changing the culture around self-care.
Right, exactly. And Hillary Coles was really insightful on this. She understood that people, especially younger generations, were looking for a more open self-care approach. The old ways felt out of touch.
Yeah.
She talked about creating a spectrum of options, recognizing that people are at different stages in how they think about their health and appearance.
So Hims and Hers was about more than just selling products. They were trying to change the conversation around self-care, especially for men who might not have been as comfortable with that idea before.
Right. It was about giving people permission, especially men, to take their health and appearance seriously without feeling embarrassed, expanding the definition of self-care beyond just working out or eating, right?
And that approach clearly worked. The growth they had in those early years was incredible.
It was amazing. Between 2018 and 2019, they grew so much they were getting a ton of media attention. Sales were skyrocketing as they added all these new product categories. And by January 2019, they had reached unicorn status, meaning they were valued at over $1 billion.
Wow.
Which is incredible for such a young company.
That is incredible. And they also started to have a physical presence in stores.
They did. In 2019, you could start finding Hims products on the shelves at Target, which was a big step in reaching a wider audience, people who maybe preferred to shop in person.
Right. It made them more mainstream. And Dudum was saying that they had thousands of patients using the platform every day by that point.
It was incredible. By late 2019, he said they had 2,000 to 3,000 patients using the system daily across all their specialties.
Wow.
What started as a pretty niche men's grooming company had become a full-blown multi-specialty telehealth service.
Amazing. And to think that that huge volume of orders in their first week almost broke them,
Oh, yeah.
They had to really scramble to get more doctors and build up those pharmacy partnerships to keep up.
It was a mad dash, but they made it work.
They did.
Yeah.
But through it all, they stayed true to their mission.
Absolutely. That core idea of making healthcare accessible, personalized, and stigma-free remains central. Dudum often talked about creating a new front door to the healthcare system,
Yeah.
one that people actually liked and found easy to use, which was a pretty radical concept compared to the traditional way of doing things.
It was so with telemedicine being the backbone of hims and hers, how did they make sure that the technology and the user experience were up to par, especially as they grew so quickly?
That's where Melissa Baird, their COO, comes in. She was really focused on making the telehealth experience not just convenient, but also really secure and compliant with all the regulations.
So it wasn't just about making it easy, there was a focus on quality and building trust.
Exactly. They took security seriously.
Yeah.
They built the platform with strong encryption. They were HIPAA compliant. They had all these quality control measures in place.
Yeah.
They even had their medical team reviewing the content on the website to make sure everything was medically accurate.
Wow. So they really wanted to be seen as a credible source for health information.
Oh, yeah, they wanted to be trustworthy, especially for people who might be a little hesitant about online healthcare. And at the same time, their tech team was constantly making the user experience better.
Right.
They moved away from those really impersonal questionnaires. They made the intake process more conversational. People could communicate through messages, video calls or phone calls, whatever they were comfortable with.
So the idea was to make it as good as, or even better than, seeing a doctor in person.
That was the goal, to provide care that wasn't just convenient, but also felt really safe and effective, maybe even better than what some people were getting in those traditional healthcare settings.
So by 2020, they had this really impressive telehealth system in place, connecting all these patients with doctors every day seamlessly through their platform. And then the pandemic hit,
Yeah.
which must have been a huge turning point for a company built entirely on remote healthcare.
Oh, it was massive. The pandemic really accelerated the adoption of telehealth like we'd never seen before.
Yeah.
Suddenly, in-person doctor's visits became a risk for a lot of people.
Right. And Hims and Hers stepped up to meet that demand, didn't they?
They did. They saw what was happening, and they quickly launched a virtual primary care service in early 2020, which was a big expansion for them because primary care hadn't been their main focus before.
Yeah. And they were really trying to help take some pressure off the traditional healthcare system, weren't they?
Yeah, absolutely. Melissa Baird talked about how they wanted to help hospitals and clinics who are being overwhelmed with COVID patients. They
Wow.
wanted to give them some breathing room.
And they even offered those early telehealth visits at cost as a way to help people.
They did. It was like a public service.
Yeah.
They used their network of medical providers to handle all sorts of routine health issues online, things like minor infections or skin rashes, anything to help people avoid unnecessary exposure to the virus.
Yeah.
And the speed at which they launched this new service, it was incredible. It really shows how flexible their technology was and how quickly they could adapt to these changing circumstances.
It's really impressive. And they didn't stop there. Mental health also became really important during the pandemic.
Oh, absolutely. They had always planned to expand into mental health services eventually, but the pandemic really sped things up.
Yes.
People's anxiety and stress levels were through the roof, so they knew they had to act fast.
So what did they do?
Well, by mid-2020, they had rolled out online psychiatry services in most states so people could get virtual evaluations and prescriptions for mental health medications.
Wow.
They also introduced therapy sessions in some states, and they even started these free anonymous online support groups led by licensed counselors.
That's great.
It was for people who maybe weren't comfortable with one-on-one therapy right away.
Right. So they were really trying to provide a range of options for people to get the help they needed.
Exactly. And by the end of 2020, they were offering psychiatry in a lot of states and therapy in a growing number as well.
So they were really making a difference. And this whole period really solidified their culture of putting the customer first.
Oh, yeah. It was all about adapting to meet those changing needs. And Melissa Baird said something that really stuck with me. She said that the pandemic basically fast-forwarded the adoption of telehealth by decades.
Yeah.
It's true. People who might have been skeptical before suddenly saw how convenient and effective it could be.
Yeah. And even doctors started to realize the potential of telehealth, didn't they?
They did. A lot of healthcare professionals saw how flexible and efficient it could be.
Yeah.
It was a real validation of what Hims and Hers had been doing all along.
It seems like the pandemic also pushed them to think even bigger about the future of healthcare.
Yeah.
Things like at-home diagnostics and remote monitoring.
Yeah, it definitely planted those seeds. Their later investments in at-home lab testing were a direct result of that thinking.
It makes sense. So the biggest takeaway from 2020 was that Hims and Hers had evolved. They weren't just a niche online pharmacy anymore.
Right.
They were becoming a full-fledged healthcare provider.
Exactly. They were offering a really diverse range of services all in one place.
It's incredible how far they'd come in such a short time, and by early 2021, they were offering everything from sexual health and hair care to mental health services, even primary care, all through their platform.
Yeah, it was pretty amazing, and Dudum's vision of a new front door to healthcare was becoming a reality.
It really was. And all that success led them to go public, right, in 2021.
Exactly. They made the big decision to go public, and they did it through a SPAC merger, which was a popular way for fast-growing companies to get listed on the stock market quicker.
Okay, so why did they choose a SPAC instead of a traditional IPO?
Well, at the time, SPACs were seen as a faster option than a traditional IPO,
Okay.
and it worked out really well for them. The SPAC deal brought in a lot of money, about $280 million, and when the merger was finalized in January 2021, their valuation was around $1.6 billion.
That's a lot of money. And it was a pretty symbolic moment, too, wasn't it, ringing that opening bell at the New York Stock Exchange?
Well, it was a big moment, yeah. On January 21st, 2021, Andrew Dudum rang the bell, and Hims & Hers Health Inc. started trading on the NYSE under the ticker symbol HIMS.
Them's the code.
And they even had this huge banner on the NYSE building with their logo and the tagline, "The Future of Healthcare."
That must have been pretty cool to see.
It was a real sign that their digital approach to healthcare was being taken seriously. It was a validation of their model.
Absolutely. And that influx of cash allowed them to expand even more and make strategic acquisitions, like when they bought Apostrophe.
Right. In 2021, they acquired Apostrophe, which was a teledermatology company known for their personalized skincare formulas.
So a pretty significant purchase.
Yeah, it reportedly cost them somewhere between $150 and $190 million.
So what did Apostrophe bring to Hims & Hers?
Well, Apostrophe had built this great network of dermatologists, and they also had their own compounding pharmacy. They specialized in creating custom skincare formulas, combining different ingredients in very specific amounts to treat things like acne based on a person's individual skin type.
Wow, so really personalized.
Yeah, exactly. And by acquiring them, Hims & Hers not only got their customer base, but also all that expertise and those compounding capabilities.
Right.
So they could offer these advanced personalized dermatology treatments to a much wider audience.
It's like they were strategically filling in the gaps in their services, and they also continued to expand their own product lines right throughout 2021 and 2022.
They were really busy in the sexual health area. They introduced things like hard mints, which was a chewable form of ED medication.
Interesting.
They even developed a combination pill for both premature ejaculation and ED, which they launched in 2024.
Wow, keeping busy. And what about hair care?
Oh, they had new topical treatments, including a spray that combined finasteride and minoxidil,
Yeah.
and they expanded their line of shampoos and conditioners. They also introduced personalized hair loss solutions specifically for women under the Hers brand in 2023.
So they weren't neglecting that side of things. And skincare.
Skincare, too. They doubled their selection of over-the-counter skincare products through a partnership.
Yeah.
They had cleansers, moisturizers, SPF, dark spot correctors, you name it.
So really comprehensive range.
Yeah, and in mental health, they were growing rapidly, too. They hired a senior VP of mental health in 2023. They partnered with Kristen Bell as a mental health ambassador. That same year, they expanded their therapy services and launched anonymous peer support communities.
Oh.
And they kept their general primary care telehealth service going as well.
So a lot going on. It's impressive how much they expanded their scope, and by late 2022, they had helped over 1 million people through telehealth consultations.
It's incredible when you think about it. That's a huge number of people, and it really shows how much people were starting to trust and rely on their platform.
Absolutely. And then there was the launch of Heart Health by Hims in mid-2023, which was interesting because it was their first foray into preventative health care.
Yeah, it was a really smart move. They realized they could connect sexual health treatments with heart health.
Okay. How did that work?
Well, their doctors can now personalize ED treatments by combining them with medications that were also good for heart health. Things like low-dose statins if it was appropriate.
Well, so taking a more holistic approach.
Exactly. It was a big step towards them becoming a platform for managing chronic conditions and promoting preventative care. They even partnered with the American College of Cardiology.
Wow, so they were working with the experts.
They were, and they integrated the ACC's guidelines into their Heart Health by Hims program. They also partnered with LabCorp so their customers could easily get lab tests done.
So really convenient for the customer.
Yeah, and it showed that they were getting more clinically sophisticated. They were moving beyond just those basic treatments they started with.
And they were serious about it.
Oh, yeah. They wanted to become a platform that could handle more complex health needs. And Dr. Ami Pot from the ACC said something really interesting about this. She talked about how Heart Health by Hims could help identify patients who might be at risk for heart problems and educate them about those risks.
That's a great point. Prevention is key. And of course, with all this growth, they had to adapt their internal structure and their leadership team, too.
Absolutely. They brought in some heavy hitters, experienced executives from the tech world and the pharmaceutical industry, people like Corey Schultz, who had a ton of experience. They also brought in a dedicated CMO for hers and a chief design officer, so they were serious about maintaining high clinical standards and making the user experience even better.
It sounds like they were really setting themselves up for success. And throughout all this, Andrew Dudum remained the CEO.
He did. He was still at the helm, guiding the company and constantly emphasizing their mission. Their internal slogan was helping the world feel great through the power of better health, which is pretty inspiring.
It is. And then we get to the more recent years, 2023 and 2024, and the explosion of interest in those new GLP-1 medications for weight loss. Hims and Hers made a big splash in this area.
They did those GLP-1 drugs like semaglutide, which are sold as Ozempic, and Wegovy became super popular, but they were also really expensive and hard to get.
Yeah.
And Hims and Hers saw an opportunity to make them more accessible and affordable.
So it wasn't just about selling the brand name drugs.
No, at first they had a weight management program with more traditional weight loss strategies, things like lifestyle changes and nutritional guidance.
Okay, they're basic.
But then they started offering compounded semaglutide injections.
Compounded meaning?
Meaning made by a special kind of pharmacy called a compounding pharmacy. They're allowed to make certain medications during drug shortages, and because of that, Hims and Hers could offer these compounded injections at a much lower price than the brand name ones.
So they were taking advantage of a loophole in the system to make these treatments more affordable.
You could say that, and from late 2023 into 2024, they went all in on their weight loss program. They called it Weight Loss by Hims and Hers, and it was a whole package.
Okay, what was included?
You'd get a telehealth evaluation with a doctor if you were eligible, access to those compounded semaglutide injections, and personalized coaching to help you make lifestyle changes. They even had compounded oral medications for people who didn't want injections.
Wow, so they were covering all the bases, and they really emphasized affordability, didn't they?
They did. They even had a special initiative in September 2024 where they offered compounded GLP-1 for as low as $99 a month for certain essential workers like teachers and firefighters.
Wow, that's incredibly generous.
It was. And their regular prices for those compounded medications were still way lower than the brand name ones.
So they were really trying to make a difference, and Dudum was very vocal about this whole issue of access to medication, wasn't he?
He believed that safe and effective healthcare should be available to everyone regardless of their income, and this pricing strategy was a reflection of that belief.
Yeah.
He wanted to make these potentially life-changing treatments accessible to as many people as possible.
And it seems like this move was hugely successful in bringing new customers to their platform.
It was a massive success. By late 2024, tens of thousands of people had signed up for their weight loss program, and they had a lot of people reporting an average weight loss of about 10 pounds in the first month.
Wow.
So the results were speaking for themselves, but of course, with that kind of rapid growth, there must have been some operational challenges, especially with the supply chain for those medications.
Oh, yeah, absolutely. Getting those compounded medications reliably was a big hurdle they had to overcome.
So what do they? Well, they made a really bold move in mid-2024. They acquired their own peptide compounding facility in California.
Really? Their own facility?
Yeah, it was a big step.
Wow.
Most telehealth companies don't own their own manufacturing facilities.
Right.
But they were serious about controlling their supply chain. And it also gave them the ability to explore new peptide-based therapies in the future.
That's a smart long-term strategy. And all this attention on telehealth, weight loss, and compounded medications did attract some scrutiny from regulators, didn't it?
It did. There were concerns about overprescribing and the safety of compounded medications being distributed online.
Right.
Hims and Hers wanted to make it clear that they were being responsible, so they emphasized their commitment to safe and personalized care.
Yeah.
They even published information about their procedures for ensuring safe access to GLP-1 medications, and they brought in experts in pharmacy and regulation to their leadership team in late 2024.
So they were taking those concerns seriously. And then there was that Super Bowl commercial in early 2025.
Oh yeah, that was a controversial one.
It was called Sick of the System, right?
It was, and it was basically a direct attack on the pharmaceutical industry and the healthcare system for making weight loss medications so inaccessible to so many people.
Right.
And they positioned Hims and Hers as the affordable alternative.
It was a bold move, and it got a lot of attention, but it also got them some criticism, right?
Yeah, some U.S. senators were concerned about the claims they were making in the ad, whether they were misleading and whether they were properly disclosing the risks.
And the FDA had also issued warnings about unapproved GLP-1 drugs.
Right.
So there was a lot of scrutiny.
There was, and it really showed how tricky it is to disrupt an industry while staying on the right side of the law.
Yeah.
But even with all the controversy, the ad definitely generated a ton of buzz, and Hims and Hers got a lot more inquiries about their weight loss program. Their stock price even went up after the Super Bowl.
Wow, so it seems like the gamble paid off, and despite all the regulatory challenges, they actually achieved profitability by the end of 2024.
They did. Their weight loss business was a big driver of that success, and they continued to see strong revenue growth. Their customer base was also becoming more and more diverse.
So they were expanding their reach, and they didn't stop investing in technology either, did they?
No, they kept innovating. They even launched this AI-powered tool called MedMatch, which was designed to help doctors make better treatment decisions.
Okay, so AI playing a role in healthcare now.
Exactly. Initially, they focused MedMatch on mental health. So the AI would analyze a ton of patient data, looking for patterns and correlations between symptoms treatments and patient demographics.
Interesting.
And then it would give doctors suggestions for personalized treatment plans based on all that data.
Wow, so the AI is like a virtual assistant for the doctor.
That's a great way to put it. And they have plans to expand MedMatch to other areas of healthcare, too.
So as we stand here in 2025, it seems like Hims and Hers is at a crossroads.
Yeah, they have a ton of opportunities for growth, but they also have some tough decisions to make.
So what are some of the big challenges and opportunities they're facing right now?
Well, one big decision they made recently was to shut down Apostrophe, the dermatology company they acquired a few years back.
Wow, that's surprising. Why would they do that?
Well, they basically decided that it made more sense to integrate all their dermatology services directly into the Hims and Hers platform.
Okay, so streamlining things.
Exactly. It simplified their operations, made things more efficient for customers, and eliminated any redundancy.
It makes sense, but it also led to some job losses, didn't it?
It did. Unfortunately, some people from the Apostrophe team were laid off, but the company emphasized that this is all about streamlining and not because their weight loss business was slowing down. In fact, they're probably going to shift even more resources towards that area.
Yeah, it's their cash cow right now.
Yeah.
So while they were consolidating on one hand, they were also expanding on the other with the acquisition of Tribe Labs.
That's right. Tribe Labs is an at-home diagnostics company, and this acquisition was all about building a more holistic care model.
So what will Tribe Labs allow them to do?
Well, they'll be able to offer at-home lab testing to their customers, which is a big deal because it gives them a lot more data to work with.
Right.
Instead of relying solely on what the patient tells them, they'll have objective lab results to help inform their decisions.
That's a big step towards becoming a one-stop shop for healthcare.
It is, and it also opens up new possibilities for them that they could expand into areas like low testosterone treatment or menopause support.
Yeah, it's all about having that data to personalize treatment plans. And Dr. Patrick Carroll, their CMO, talked about the value of this data.
Right? He did. He said it allows for more informed clinical decisions.
It makes sense. So Hims and Hers has come a long way from just selling hair loss treatments online.
They've come a long way. In 8 years, they went from a small startup to a publicly traded company that's changing the healthcare game. They've served millions of people, and they've really tapped into this desire for convenience and control over one's health.
And they've done it all while walking this tightrope between being a consumer brand and maintaining medical credibility.
It's a tough balance, but they've managed it really well. And a big part of that is their company culture. They're obsessed with the patient experience, and they're always questioning things, trying to improve.
Yeah, Dudum has really fostered that culture of innovation, and that mission to help the world feel great through the power of better health has really grown with them, hasn't it?
It has, and their strategy has been consistently playing identify a healthcare area that's stigmatized or inconvenient or expensive, and then find a way to fix it using technology, good design, and empathy.
It's a simple formula, but it's clearly working. And they've been really successful in changing how people think and talk about sensitive issues, haven't they?
They've normalized conversations about things like ED and menopause, which is really important.
It is. So looking ahead, what are some of the big challenges and opportunities for hims and hers?
Well, they need to maintain that trust and quality as they grow, which is a challenge for any company.
Yeah.
They also have to navigate the ever-changing world of healthcare regulations, which is a minefield. And of course, there's more competition now from both traditional healthcare providers and other telehealth companies.
Right.
So they need to keep innovating to stay ahead of the curve.
They do. They can't afford to become complacent.
Exactly. And they're already exploring international expansion, and they're looking to partner with hospitals and other healthcare providers, so they're thinking big.
They are. And they recently launched their ambassador program, the Hims and Hers Health Collective.
Right. They're trying to build a community around their brand.
It's really a remarkable story. It shows how technology can empower people to take control of their health.
It does. And that quote from Andrew Dudum about the future of healthcare needing to be centered on the customer, that really sums up their whole journey.
It really does. They've spent the last 8 years proving that point.
They have.
So to wrap up our deep dive, what are the key takeaways from the Hims and Hers story?
I think the biggest takeaway is that telehealth is here to stay. It's transforming healthcare as we know it, and Hims and Hers have been at the forefront of that transformation. They've shown us that it's possible to address sensitive health issues in a way that's convenient and empowering for the patient.
They've really removed a lot of the barriers that kept people from getting the care they needed.
They have, and their story is also a testament to adaptability and innovation. They started with a very specific focus, but they've constantly evolved to meet the changing needs of their customers.
They haven't been afraid to experiment and try new things.
Exactly, and that's what's allowed them to grow so quickly and become such a major force in healthcare.
So they've given us a lot to think about. And here's a question for you, our listener. As healthcare becomes more accessible and personalized, how do you see it impacting our lives in the future?
It's a great question. What are the potential benefits and what are the potential challenges? Something to ponder.
Definitely a lot to consider. Thanks for joining us today for this deep dive into the world of Hims and Hers.
It's been a fascinating journey.
It really has.
Thanks for listening.
And thank you.
Until next time.
See you then.